In our project, we are analyzing the left lower extremity when mounting a horse. When mounting a horse, the rider first steps up into the stirrup with the left leg, while keeping the right leg on the mounting block. Once the left foot is in the stirrup, the rider pushes down on the stirrup while lifting herself upward. After she lifts herself upward, she will swing her right leg over the saddle and lower herself into the saddle.
During the stepping up phase of mounting a horse, the hip is in flexion and lateral rotation. To achieve this motion, the iliopsoas, sartorius, rectus femoris, and deep rotators are concentrically contracting in the hip. The knee is in flexion due to the hamstrings concentrically contracting. The ankle is in dorsiflexion. The muscles used are the tibialis anterior, extensor hallucis longus, and extensor digitorum longus, which are concentrically contracting.
In the second phase, when the rider lifts herself up to the saddle, the hip and knee are in extension. The hip muscles concentrically contracting are the hamstrings and the medial rotators such as the gluteus minimus. The hip adductors and abductors are stabilizing the hip for balance. The knee muscles that are also concentrically contracting is the quadriceps femoris. The ankle remains in dorsiflexion, but the plantar flexors are in use as well, stabilizing the foot in the stirrup. The plantar flexors include the tibialis posterior, soleus, gastrocnemius, and plantaris, all concentrically contracting.
During the third phase, the rider swings her right leg over the saddle and lowers herself down. To achieve this motion, both the flexors and extensors of the hip are in use. The hip flexors, which are the iliopsoas and the rectus femoris, are eccentrically contracting. The hip extensors are the gluteus maximus and the hamstrings, which are also eccentrically contracting. In the knee, the quadriceps femoris are eccentrically contracting to lower her into the saddle. The ankle is isometrically contracting using both the ankle plantar flexors and dorsiflexors.
After analyzing the motions of mounting a horse, one can see that many muscles in the leg are used. Since there is a great deal of concentric and eccentric muscle contractions involved in the lower extremity, this makes a great way to implement physical therapy in horseback riding.